up. We're going to give them just a couple more minutes for them little bit of stragglers, and then we'll go ahead and start, okay?
Okay. Can you hear me okay? Ooh. Wearing a microphone is kind of weird.
If anybody asks you a question, to please repeat the question.
Oh, okay.
So that way it can be recorded. And everybody knows what's going on.
Okay, thank you. All right, so hi, welcome. Have I seen any of you before? I feel like some of you look familiar. So I've been asked to talk about allergies and smoking and kind of each of those individually and kind of how they relate to each other. So when we talk about allergies, I see a lot of different allergy symptoms. A lot of people think of, kind of like the sneezing and itching and runny nose kind of thing in terms of the allergy symptoms. But in honesty, the most common allergy symptom is nasal congestion. So sometimes I have people come in who just have a stuffy nose, and that's it. They never sneeze, they never have itchy eyes, never do any of those things. It's just congestion. So, allergy symptoms are a pretty broad picture. You can get symptoms with the ears. Most commonly, it's itching. We do see a lot of people who have just pressure in the ears or feeling like your ears won't pop. Or they will pop, but it takes a lot of effort to get that to happen. That's usually in relation to a eustachian tube dysfunction that has to do with the allergies as well. The eyes are another system that we get allergy symptoms with. That's a little bit more typical and standard, itchy, watery. Sometimes the actual whites of your eyes will get kind of swollen, which is no fun at all. The nasal symptoms are the most common. Like I said, the congestion, runny nose, sometimes even bleeding because of the constant irritation and swelling that's in the nose. The other symptoms are a lot less common, a little bit more difficult to kind of pinpoint in terms of allergies. I have patients that we see who are only have headaches, and that's the only thing we're treating their allergies for. They never have a runny nose, they never have itchy ears, they just have headaches. Nausea, GI symptoms like diarrhea, upset stomach, things like that. Those are a little bit less common, but we definitely see all of those things in relation to allergies. The immune response, so it's kind of important to understand how this happens, so you kind of get an understanding of how medications work and how allergies happen. So when you, where's my little pointer here? Oh, there we go, okay. So when you breathe something in, you're breathing in the little antigen here. This B cell recognizes it and makes these little antibodies that recognize only this. So then these antibodies attach to these mast cells. And then when they see this again, so like the next time you go outside, you breathe this in, your body recognizes and says, oh, we know what that is. Now we're going to release all of this histamine. So, histamine probably sounds familiar. You hear about like antihistamines, Claritin, Zyrtec, Allegra, all those commercials. And they're trying to block this response right here. So it doesn't change the fact that you have these antibodies. It doesn't change the fact that your body recognizes those things that are floating around in the air, but it blocks this process right here. So when we talk about allergies, we can do a few different things. First thing that we can do is avoid the things you're allergic to. Obviously, that's easier said than done. Most of the time, well, when we talk about treating allergies and testing for allergies here, we're looking at a couple different things. So I kind of separated into two categories because that's how we test for them. So the first category is your environmental allergies. So things that, around you that you breathe in. So that's going to be, in the springtime, that's going to be your trees. When all the trees start to flower and bloom, that's, the springtime allergies. So, you've got cedar and elm and maple and oak and all of those trees. Once we start moving into the hotter weather, then we start getting into the grasses. And there's, a handful of different grasses that are around. It's kind of interesting. A lot of people associate when the cottonwoods start, when that cotton starts falling through the air, as that being an allergen. That actually is not pollen. That's actually the seeds from the tree. But the time of year when that's happening, the grass levels are extremely high. So people will associate the trees, but it's actually the grasses that are bothering them. In the fall time, we have the weeds. I feel like we have weeds all the time. But the weeds are really bad in the fall time, and that's when we usually start seeing those. And then we have the molds. So we have indoor and outdoor molds. So you got your molds that grow, on the stuff in your fridge. And you've got the molds that grow like in the pile of wet leaves and, under all of the wet things inside and outside. The mold that grows, in the walls in the house if you have a pipe leak, all of those kind of things. We test for about 8 or 9 different molds when we look at that. We then have a category we call just year-round allergies. So that's going to be your dust mites. So no matter how clean you keep your house, everybody has dust mites. Most commonly found in fabric surfaces, so it's going to be your carpet, your drapes, your bedding, all of your linens, your couch, if it's not leather. And then you'll also find a lot of dust mites around paper. So like if you have like a bookshelf with a lot of books, you're going to find dust mites there. The other indoor allergen that we have that's year-round is pet dander. So whether it's in your house or whether it's in somebody else's, it's there and it's around all the time. So those are kind of the inhaled allergen panel that we look for. So you can kind of see that no matter what time of year it is, there are, a good 8 or 10 things in the air that you have the potential to be allergic to. Because I have a lot of people come in and say, well, I have problems all year round. It's not just in the spring, it's not just in the fall. When it's isolated like that, it's a little easier to determine, but when it's, every single day of the year, because of all of those allergens, it's sometimes a little bit trickier to nail down. So avoiding those things, obviously, is easier said than done, because most of the time, by the time you get to me, you have some pretty significant symptoms. So we do an allergy test, and we do a skin test on your arm, and look at all of those things to say, okay, well, what of those things are you allergic to? Really, more importantly, how allergic are you to those things? Because it's usually not just one thing or 2 things that you're allergic to. It's usually 20 or 30 things. So when we talk about avoidance, you can't avoid every tree, grass, and weed that's out there. So that's going to be things like, when you go and you mow the lawn, you come in, you change your clothes, and take a shower. Wash your face, rinse your nose out with some saline. Not sleeping with your window open at night, because that's letting all of those pollens in at nighttime. Making sure in terms of pets, obviously no pets would be ideal. Outside pet would be next on that list. An inside pet that stays outside your bedroom would be next on that list. And if all else fails, don't let your cat sleep on your face when you're sleeping at night. The medication, we'll get into the different medications that we have here. So we have medication as an option, and then the immunotherapy, and that's the allergy shot. So these are some total of the treatment, and we can do any combination of these things or any one of them. So here's a few of the other avoidance. So washing your sheets in really hot water will help as well, so to get all that stuff off and to kill the dust mites. Let's see, frequent vacuuming and wet dusting. So like if you're dusting, you don't want to stir it all up in the air if you have allergies, because then you're just going to breathe it in even more. So with our medications, here we came back to that antihistamine. So the antihistamine, remember, its job is to block that response. When we have a histamine response, That's like, I always think of it as like the runny, itchy part of allergies. So when your nose just starts running, your eyes start running, your ears and your eyes and your nose and your throat, everything itches, that's the histamine response. So all of these things that we're doing, all of these medications, none of them change the fact that you're allergic to whatever it is in the air. It just helps to control your response. So these are the most common ones we usually use. So Benadryl, I think everybody probably knows Benadryl. Benadryl is actually the strongest of the antihistamines, but it also comes with the most side effects. You know, Benadryl typically knocks you out unless you're like a 5-year-old kid, and then it can wire you, which is fun too. So, you know, Benadryl is good for like nighttime use, but again, it does come with pretty strong side effects that way. So these 4 here are the ones that we see used most commonly. So the Claritin is good for mild allergies. Mild allergies. So, you know, if you take a Claritin, you're like, yeah, I'm good, then great, then you can use that. But if Claritin's not cutting it for you, Zyrtec and Allegra are about equal in terms of how strong they are, but they're a step up from the Claritin. They're both non-drowsy. And Xyzal just very recently came over the counter. It's still available by prescription, but you can get it over the counter also. And Xyzal is like super Zyrtec. So it's kind of another step up as well. And, you know, as we go up here from Claritin to Zyrtec, Allegra, and Xyzal, we go up in cost as well. So most people will start with the Claritin and work their way up from there just until they find something that works. Nasal steroids. So steroids are good for inflammation. They're bad for a lot of different reasons, but when we use it in a nasal spray form, it's very, very safe. So the steroid inside the nose, its purpose is to help decrease that swelling that occurs when you have that allergy response. So if we can decrease the swelling, then you're going to have less congestion, less drainage, less pressure in your head and face. And these generally work really well. The key is you have to use it every day because the steroid effect works a little bit more on its own effect each day. So if you just use it, excuse me, if you just use it here and there, you're going to get day 1 effect every time, as opposed to, you know, the day 7 effect or the day 12 effect. And it actually takes 4 to 6 weeks of being on it daily before it reaches its maximum potential. So if you try a nasal steroid, you want to use an entire bottle of it for a whole entire month before you make any judgments about if it's helping or not. There's more than this out there, but these are the most common ones that we see. There's also one more that I didn't put on here. So Flonase, Flonase is over the counter. The other one that I didn't put on here is Nasacort. It's also over the counter. And in terms of the nasal steroids, they're all fairly equal. One person will swear by one and one person will swear by the other. It's just kind of how each person's body reacts to that specific steroid molecule. But they're all steroids and they all work generally really well. Biggest side effects that we see with this, nasal bleeding because it dries out the inside of your nose. Typically, you can counteract that by using some nasal saline, so you can still get the benefit of it without having the dryness. Sometimes we do see people will get headaches with the steroids. If that's the case, then there's not much to counteract it, and usually we'll have you just get off of it because headaches are no fun either. Mast cell stabilizers, we don't use these a whole lot. The one that we see is cromolyn. In that diagram, it was kind of towards the back here. The mast cell is the one that held those little Ys that recognize it, so that helps, you know, that part of the process. But again, we don't really see this much anymore. We've got things that are better. And then the leukotriene inhibitor, Singulair, which is now generic, we call that Montelukast, is a good adjunct. We don't usually use it a lot on its own because it's not really powerful, but it's a good adjunct if we need to add one more thing. Singulair is also good for somebody who has like an asthma and allergy combination because it works for both parts of that. So when we talk about the allergy testing, there's 2 different types of testing. So the skin prick testing, the skin prick testing is done by somebody who's an allergist. And what that is, let's see, I think I've got a picture of it. So they make a grid. Usually they do it on your back. And they'll drip the allergens onto little spots in that grid. And then they take that little poker thing, probably a more technical name for it, and then they press the allergen through the skin into your body, and then they watch for a response when that happens. There we go. So you can do a lot of different things, and a lot of times you'll see allergists doing foods and environmental stuff, and they can do a large volume of different allergens during that testing. But you can miss low sensitivity. Oh, good spelling. You can miss low sensitivity, lower sensitivity reactions with that. It may not react because there's such a small quantity going through. The second type of testing, the type of testing that we do as ENTs, is intradermal testing. So rather than putting the allergen on the outside and pushing it through, we actually are injecting it. So we're using needles to place the allergen into your skin. And we usually do our testing on the upper arm. So it's more reproducible because we actually measure exactly how much gets in because we have the measurements on the syringe. A little bit higher sensitivity. I do have people come in who say, I had allergy testing. I had that scratch test on my back, 10 years ago, and they said I wasn't allergic to anything, but I've got a runny nose all the time, and my eyes itch, and Zyrtec kind of helps. So I'm like, well, sounds like allergies. Let's take a look. And we'll oftentimes find some of those lower sensitivities with the intradermal testing. There is a higher risk for adverse events because you're getting more of the allergen. So, you're at a higher risk of having like an allergic reaction during that testing. So we make sure you stick around for a little while afterwards. When we do the intradermal testing, we only do the inhaled allergens. We don't do any food testing this way because the research has shown is just not very accurate to do with this type of testing. So these are the ones that I talked about before with the weeds and the dust mites, pet dander. We have dogs and cats. And we also, in our panel, just recently added horses and feathers. We don't always test for horses and feathers unless you say, yeah, I'm around that. I live on a ranch, or my neighbor's got horses, or I've got a down comforter, down pillows. Then we'll look for the horses and feathers as well. There's no age range with the testing. There's no hard and fast rules, but we usually say somewhere around 4 or 5 we can start. That doesn't mean that every 4 or 5-year-old is created equal. Some of them may be able to tolerate the testing because it involves like 50 to 70 injections in your upper arm. And the injections themselves are not really bad, especially for kids, because we put a patch of numbing cream on their arm before we even do it. But the emotional part of the idea of getting injections doesn't usually go over with a lot of kids. But some kids do okay with it. And then when we do the testing, we don't want you to be taking antihistamines because what we're looking for during the testing is actually that histamine response, that swelling reaction. Because we want to see when we put this inside of you, how big does the reaction get? And that tells us how sensitive you are to those things. So you have to be off. And some of those different antihistamines, like Benadryl, because it has a longer half-life, it sticks around in you longer, you have to be off of that for 7 days, whereas something like Zyrtec, it's shorter acting, so you only have to be off of that for 3 days. But sometimes for some people that can be a rough few days. The nasal steroids don't affect your testing outcome. So remember we said you want to be on that every day. So even when you have testing, go ahead and keep taking that because it won't affect your outcome. And then we said it's 50 to 70 injections because we have a starting point, and based on the reactions we get at that starting point, we'll either go up or down until we find that end point to where you are actually allergic to those things, your limit. This is what the intradermal testing looks like. So you can see, have you guys ever had a PPD, a tuberculosis test, a TB test, like on your arm right here? Yeah, it looks like that, where you kind of stick it underneath. So it's not going like straight down into like your muscle, like when you get like a flu shot or something. It's just going right underneath the skin there. And so this one you can see alternate areas of mold, daisy pollen, grass pollen, and then we measure the reaction. So this one they've done on someone's arm. I couldn't even find a picture of where they did it on the forearm. I can't find where they did it on the upper arm like we do. So when we get the results, if it didn't react, if we didn't get a swelling response, it's a negative. So that means you're not allergic to whatever that item is. So the positive, we measure the size of the wheal is what it's called, that welt that shows up after you get the injection. And we get everything from 2 to 6. I have seen a couple 7s, and that just has to do with the concentration that we give you and how big the response is. So basically, the higher the number, that means we're giving you smaller and smaller concentrations, and you're still reacting. So your body has a cumulative effect when it comes to allergies. which means like each individual one, like let's say this one was, one of the molds. Oh, I reacted a 2. A 2 is the lowest number we get. It means you're allergic to it, but it takes a lot of it in the air before you really start to react. The higher the numbers, you can see, the bigger the reaction. We need to get to this point before you have symptoms. So whether your symptoms are headache or runny nose or stuffy nose or whatever it is, you have to get to this point. So you can see each one of these individually is not going to get you there. But your body has a cumulative effect. So everything that's in the air at any given time that you're allergic to, inside, outside, it doesn't matter, is going to add up like this. So you can see these are all like 2s, but having 9 2s will get you to that point just as easily as 3 5s kind of thing. When we talk about, we talked about the medications, we talked about the avoidance, the immunotherapy is the other option that we have, and this actually changes the bottom line. This actually changes what your immune system looks like in regards to these specific allergens. So those little Ys that were attached to those mast cells that recognize the allergens, that actually goes away to some degree. So when we do this, you get allergy shots. So that means we're giving you all of the things that you're allergic to at the concentrations where you're allergic to them, and then we slowly build you up to the highest level, which is what we call maintenance. It's a 3 to 5 year process. The research shows that we need to do the injections every week for 2 full seasons of exposure to all of the things. So 2 springs, 2 summers, 2 falls, 2 winters. So that obviously computes to 2 years. After that 2 years, After that 2 years, then we base the treatment on what your symptoms are. So if you're at that point, you're like, yeah, I'm doing great, I don't need to take my allergy medicine anymore, life is good, then, let's see if I can put this down a little bit lower. There we go. Then we start to taper you down to every other week, and then every month, and eventually off of them. If at that point, after 2 years, you're like, well, I'm better than I was, but I still have some problems, well, then we still go a little bit longer and just kind of, keep checking on you and keep trying different things. During the shots, you're supposed to avoid extra allergen exposure. Because when we're giving you the shots, we're giving you all that stuff you're allergic to. So it's like you're getting an entire year's worth of allergy in one day. So if you then go out and mow the lawn or weed the yard or wash the dog or something like that, then you're getting even more of the allergen exposure, so you're at a higher risk for a reaction. All of our patients get an epinephrine injection device for precaution, basically. Rarely have to use it. This is the kind of thing that when you need it right away, so you need to have it. And then, avoid challenging the immune system. So, if you're sick with a fever, we don't want you to get a shot. Your immune system's already stressed. If you, want to get a flu shot, shouldn't be on the same day as your allergy shot, because those are things that will stress your immune system. They're supposed to, but we don't want to do it, with something that's optional. So I found some fun pictures of smoking, because I thought, okay, we want to talk about smoking and how it relates to allergies and things like that. Well, again, so we talked about how most of your allergy symptoms are nasal symptoms, eye symptoms, so I think this is actually really a real picture. This guy was like going for some kind of record. It's awesome. So obviously not everybody's smoking like that. This guy also thought it was a good idea. So this is more of a realistic picture. So you think, okay, well, smoking is bad, right, because it causes lung cancer, because you're breathing in all of the toxins and the fumes and things like that. But in reality, that your airway, we consider it one airway. So like from your nose all the way into your lungs, it's like all the same type of tissue. It's affected by the same things. And it's affected by smoking just like your lungs are. Just the processes are different. So like, when you inhale, you're breathing in through your mouth, usually, unless you're those other 2 guys. But then you're exhaling through your nose and through your mouth. So your nose is getting the exposure of the smoke just like everything else is. And here we've got another one. So she's using an e-cig. And you can see, she's inhaling through her mouth, but there's still that vapor that's going up through her nose, it's coming out through her nose. So, whether it's a, an actual lit cigarette or whether it's an e-cig, you're still getting that chemical exposure. And, you don't have to know what all these chemicals are, but these are some of the terrible things that are in cigarettes. Arsenic, it's a poison. Nicotine, it's an herbicide, insecticide. Carbon monoxide, that prevents you from circulating oxygen. All kinds of things. So there's all of this, plus there's the tar in the cigarette. And these is like a really cool electron microscope picture of the cells in your lungs as well as in your nasal passages. So this bottom part down here, this is like the cell body. And then this little hair stuff up here, that's called cilia. And the cilia's job is it's kind of like, like a sea anemone looks like, and it kind of waves, like this. So its job is to push things out of your nose, out of your lungs. And it waves along, and something will sit there and it'll eventually make its way out, kind of like crowd surfing. But when you smoke, then all of this is coated here. So like that tar, those chemicals, it will start coating all of the cilia so that it weighs them down, and they can't do their job, and they can't get things out like they're supposed to do. So it causes some damage there. It can actually kill these cells as well, so that your lungs, but as well as your nasal passages, they can't clear things out like they're supposed to clear things out. So you can't, one, clear your own secretion. So everybody makes mucus. We're supposed to. That's what we do. We make mucus, and you're supposed to be able to get it out. It's supposed to run down the back of your throat and disappear. It's supposed to run out and blow out of your nose. But when it can't move in there, then it tends to get stuck and get dry and get congested in there. It makes you more prone to having like infections if things can't get cleaned, basically. But also foreign material, so viruses, bacteria, and allergens. So here's our connection. If you're outside and you're breathing in those things that are outside, the tree pollen, the grass pollen, you breathe that in, those little particles go inside your nose and, stick around inside your nose. A normal, healthy nose is going to push those particles out and get rid of them because they don't belong there. But when that cilia can't work because of the effects of all the tar and the chemicals, then all of those things stay there. So you're going to have more of your effects of the allergens because those chemicals and those allergens are just sitting in there, continuing to cause problems. So some of the other things, we talked about the tissue death, but also, before that is the inflammation process. So those chemicals, if you can imagine if you were working with chemicals, you poured chemicals, depending on what it is, on your skin. Maybe it's acidic, maybe it's basic. You're going to get swelling, you're going to get redness, it's probably going to hurt if you, get the wrong kind of chemicals on your skin. The same thing goes on inside your nasal passages. There's not pain receptors in there, but it does cause that inflammatory reaction. And when you have inflammation in the body that lasts from whatever the cause is, if that inflammation is persistent, then your body eventually stops making it inflammation and turns it into scarring. Well, you can imagine, if you have a scar anywhere on your body, it never ever looks like the rest of the skin around it again, because it's not made out of the same stuff. It doesn't function the same way. It gets close, but it's not exactly the same. So the same thing happens inside your nasal passages. That inflammation becomes scarring, and then that tissue never works the same as it did again. We're pretty good at healing things if we have enough time, but it depends on how much damage is done as well. We also get, when we start seeing a lot of inflammation, the cells start changing. Like we said, they become scarring, but some of those cellular changes will lead to cancer. We do obviously see more lung cancer than anything with cigarettes, but you can get nasal cancer as well because of the smoke deposition. A lot of times with cigar smoke, because it's held more in the mouth and up through the back of the mouth into the nose, the nasal passage as well. Any questions about any of that? Lots of exciting things to know. Anybody have allergies, take allergy medicine? Had allergy testing?
Oh, okay.
Yeah.
So when we got AC in our house, we put, my wife has really bad allergies, and not so much anymore,
Mm-hmm.
but they put a UV light in the cold air return. So that is broken, or chopper, but that seemed to help a bunch. Is that, something you can do? Is that something that you recommend? Or?
It is. So the question was about, what could you put in your house, basically, in terms of filters and UV lights and things like that. The one thing that we recommend, the UV light can help kill particulates, which is good. But the other thing that we recommend is like something called a HEPA filter. And that's actually very proven to be very accurate at filtering out the most amount of particles. And you can have HEPA filters placed in your whole entire HVAC system, and you can also, buy separate units, that for one room, like your bedroom in particular or whatever. And those are really good at getting a lot of those particles. And that kind of falls under that avoidance measures. Anytime you can get the stuff away from you so that you don't have reactions, it's helpful for sure. Sometimes people put a humidifier on, and that can help with some of those particles as well. Although there's obviously a fine line because you get too much humidity, and then you're leaning towards that mold end of things if it's too bad. But. Any other questions? Oh, you mentioned your wife, that her allergies have gotten better. Your immune system is always changing, which is the reason why the allergy shots actually work, because we can manipulate it and we can change it. But it also means that you can develop allergies, or they can become less severe over time as well. Some people, if you have one parent that has allergies, you're more predisposed to having allergies yourself. If you have two parents that have allergies, you have even a higher risk of developing allergies yourself. So you can develop allergies. We don't usually really see inhaled allergies before age 3, but somewhere around there you can start. But let's say you didn't. Let's say you went all through childhood and you did okay. The most common time to see someone develop allergies who didn't have problems with allergies before is either in your 20s or in your 60s. So those are kind of the high peak times. So I have a lot of people come in who are like 59 or 72 who are like, oh yeah, I never had problems before, but now it's miserable. So we've got to do something about it.
She did the shots. She was doing it when we got married, and she stopped doing that. And we had a swamp cooler.
Nope. Yep.
And so the combination of the things.
Yeah. The allergy shots, they are very effective, and most people do really, really well with them. We usually tell people that there's a kind of a magic number. 'Cause a lot of people get really concerned, like, well, if I'm supposed to be here every week, can I never go on vacation, for the next 3 to 5 years? No, that's not the case. But we see that people usually get the maximum result if they're getting their shots about 90% of the time, which still leaves you about 4 weeks of the year where you can, get a flu shot or get sick or go on vacation or something. But it's the kind of thing that, you want to make that commitment to, because if you're going to be there getting a shot every week, you want to be getting through it as fast as you can and getting better as fast as you can. But the allergy shots, the results tend to last somewhere between 12 and 15 years. And that's an average. I mean, I do have people who have, were on allergy shots, and 6 years later they're like, yeah, I was doing great, and now my allergies are getting bad again. I have other people who do them, and then they never come back because they don't actually redevelop the allergens. So it just kind of depends on your body and what you do and where you are. Interestingly, also, it takes about 2 years to develop a new allergy. So, like, if you were from Georgia and you moved to Utah, you shouldn't really have problems for about 2 years. That's usually when we start to see people coming in, is 2 or 3 years after they move somewhere, and then they really start developing those allergens. But when you move to like a different climate, then it's like a whole different panel of allergens that your body has to then get used to. The allergens that we test for, we test for obviously the things that are around here. We test for the maple and the sage, or we test for the maple and the elm. But we also test for the desert climate stuff too, like we do sagebrush and Bermuda grass and things like that. Because on a windy day, we can get stuff in our air from up to 400 miles away. So that brings it from Wyoming, it brings it from southern Utah, northern Arizona. It comes from everywhere. But so if you're moving to Evanston, your panel's probably going to be about the same. But if you're moving to Georgia or Hawaii or Japan, then it's going to be way different. Any other questions? Nope. Everybody's good. Okay. Well, I have some cards up here. If anybody has other questions for me, if you have any questions afterwards, that's fine. Thank you for having me.
both right.